We start with some breaking news out of Austria. Chancellor Alexander Schallenberg has announced a full nationwide lockdown starting Monday, and it will become the first European country to make COVID-19 vaccines mandatory starting February. Only 2/3 of the country's population is fully vaccinated, one of the lowest rates on the continent. Austria is currently in the grip of a severe fourth wave of the pandemic. Let's get the very latest on the story. We have our correspondent, Fanny Fachar, standing by in Vienna. Hi, Fanny. So a lockdown and mandatory vaccination starting in February. Tell us more about these measures that have been decided and why we're seeing them now.
Chancellor Schallenberg announced what two state governors were actually asking for already yesterday. That's a nationwide lockdown. They said, the two state governors of Salzburg and Oberösterreich, which are heavily affected compared to other states, they said there must be a lockdown. If there isn't, they're going to have regional lockdowns starting on Monday. So now Chancellor Schallenberg, with that mounting pressure actually on his shoulders, made that decision, a very unfavorable decision to make. He actually said that it hurts to make this decision. After all, Christmas is around the corner, and people here who are hoping for good business are now insecure what's going to happen, because practically what's going to happen is what happened already 3 times before. This is the 4th nationwide lockdown during this almost 2-year pandemic, and that means that shops will be closed and people can only leave their homes if they need to get essentials, go to the pharmacy or go to work. That's the situation right now. And on top of that, what is really raising eyebrows among those who don't want to get vaccinated is the mandatory vaccination that's supposed to come into force starting next year, February 1st.
I know these measures have just been announced, but how much support do you think there really is in Austria for these?
The situation here in Austria, just like in many other countries where people, politicians, but health experts and just people on the ground, ordinary citizens are debating, is quite similar. People are split over these measures. You will have people say, why now? Why not already 3 weeks ago have a lockdown before, in fact, all these hospitals are on the brink of almost of a collapse? Why now? Why not even sooner? But you will also have people who will actually go to the streets, take to the streets tomorrow here in Vienna, who say this is way too much. This is a way of actually getting involved in your personal choice, whether you want to get vaccinated, and a lockdown is not the way forward. You will have different statements also on a political level, and that's what's really difficult here. As long as you do not have a united voice, both on a social level and on a political level, the question really is this a lockdown before another lockdown, another lockdown? Experts say the only way forward is full vaccination for everyone here in Austria.
DW's Fanny Fachar reporting there from Vienna, where Austria has announced it's imposing another full nationwide lockdown starting on Monday. Thank you very much, Fanny. Germany is also experiencing a severe fourth wave of the pandemic. Lawmakers here have approved a new package of measures to contain the spread of COVID-19. The number of new cases has jumped by more than 60% in just 2 weeks. The rules will impact many areas of daily life, including at the workplace.
A new daily routine at this Siemens factory. Workers queue to show their vaccine certificates or COVID-19 test results. Employees who don't comply will be suspended without pay. New measures that will soon be imposed across Germany, after Parliament approved a law to counter rampant coronavirus infection rates. It was submitted by the 3 parties likely to form Germany's next government. Outgoing Chancellor Angela Merkel had been urging action at a meeting with state premiers.
With the current momentum, we're running into a very difficult situation, especially for people who work in hospitals and particularly in intensive care. We have always said that we don't want to overburden our health system. We know that we can't prevent that across the board right now, but fortunately we still have the capacity to help in many places. But it is high time to act.
Other measures in the new COVID-19 law include a nationwide rule allowing access to public transport only to those who have been tested, vaccinated or recently recovered from the virus. With infection rates soaring, more people here want to see tougher measures.
I think too little is being done. I also think the city hesitated for too long to impose any restrictions.
A general vaccine mandate, more tests, and testing those who have been vaccinated as well. Then things will get better.
I think we have to introduce compulsory vaccinations now.
A general vaccine mandate isn't part of the new law. But a prominent health expert believes the measures will make a difference.
Restrictions that we decided today will work if they are used appropriately and if we really use them to the fullest extent.
The law has also been approved by the second chamber representing the federal states. The rules will now come into force as early as next week. This was the first test for the new constellation of federal and state leaders, and one they couldn't afford to fail.
Well, the new law includes several measures. Let's take a closer look at those now. Anyone going to work or using public transport needs to be vaccinated, have recently recovered from an infection, or they have to show a negative COVID-19 test. Here in Germany, that's known as the 3G rule. Once a specific hospitalization rate is reached, those who are not vaccinated or recovered will not be allowed to enter bars, restaurants, large events. That is the so-called 2G rule. And the measure known as 2G plus, that means those who are vaccinated and recovered, they will still have to show a negative test result to enter recreational venues. Now, there will also be a vaccine mandate for certain professions, like healthcare workers or those who work in care homes. Given that millions of Germans reject the vaccine, this will likely be the most controversial measure. Let's bring in our correspondent, Nina Hase, who's following the latest on this story for us. Hi, Nina. Good to see you. So we're talking about tighter COVID restrictions, plans to boost the vaccine uptake, but we are in the middle of this record-breaking fourth wave of the pandemic. So will this work?
Well, Angela Merkel called it extremely dramatic, the current situation that we're in. So let me look at the fact that they're trying to boost the vaccine uptake. This morning, the outgoing health minister, Jens Spahn, held a press conference, like every Friday again now, where he said in Berlin that he's noticing that people are beginning to see the dramatic extent of the current situation. And he mentioned explicitly the fact that GPs and local doctors have now ordered significantly more vaccine doses than they did 2 weeks ago. So that means that people are approaching their GPs to get vaccinated for the first time or even for the third time for those booster vaccinations. And the hope is, of course, that more reluctant people will get vaccinated now, or else they will risk losing pay at work, for example. But there are still millions of people who don't believe the science that vaccines actually work. And regarding your first question, will the restrictions work? Well, they will make life a lot more difficult for unvaccinated people, but the plans are coming very late, and there are many regions here now where there are no free intensive care unit beds anymore, and those beds are occupied by mostly unvaccinated COVID patients. And so the health minister warned that Germany really is preparing for the collapse of its health system. Let's take a listen.
We are getting to a point now where we will have to transfer COVID patients not just within the same region, but to other regions within Germany, and quite possibly even abroad to neighboring countries. The federal government and the states are in close contact about that.
So, Nina, we see lawmakers making these dramatic appeals to people. Is there support for these measures across the country?
The debate in Parliament on Thursday was intense and fractious. They debated that new law that is going to come into effect now. Angela Merkel's party, the CDU, was against the passing of that law, but you wouldn't be wrong to think that there was a certain degree of party power play at work there in that debate. And in any case, the Conservatives then didn't block the law today in the Bundesrat, which is, of course, the second chamber where the regions sit together. So the new restrictions are coming into effect. And as far as the general public support for those restrictions is concerned, there is a lot of support, because there is a sense that politicians essentially had taken their eyes off the ball to a certain degree over the summer. People were busy with the election campaign, etc. And that's something that the president of the Bundestag actually accused the outgoing government of, that they were being sluggish because of the federal election. So the majority of Germans now just want everybody to pull together and get vaccinated so that this fourth wave can actually be broken.
DW's Nina Hase reporting for us. Good to talk to you.
Well, for more, let's bring in Dr. Uwe Janssens. He's the Secretary General of the German Society for Internal Intensive Care and Emergency Medicines. Dr. Janssens, thanks for joining us on DW. The numbers in Germany are simply soaring. How worried are you?
Yeah. Yeah, Rebecca, the numbers are absolutely worrying. Almost 65,000 new infections yesterday and almost 58,000 new infections today. The 7-day incidence has peaked out at 340. And as you know, we will see patients with a severe course in the intensive care unit much later, with a delay of up to 15 days counted from now on. And currently, around 0.8% of infected people will have to be treated further in an intensive care unit during the course of the infection. And if you see at the numbers, 50,000, 60,000, you can count how many people will reach the intensive care unit in 7 to 10 to 12 days. And this is much too much to handle at this situation.
So we're likely to see then a point where Germany really, the healthcare system reaches the overload point. And yeah, could you explain a little bit about when that might happen?
Yes, at the moment we have the situation that in the south of Germany, in Bavaria, Saxony, and in Baden-Württemberg and other areas, the hospitals and even the intensive care units have such a high pressure, such a high load, that in some regions there are 0 free intensive care units beds. So we have to stop the regular operations. The regular operations has to be stopped, and the politicians didn't say anything yesterday to this very critical and point of utmost importance. So you see, if you postpone operation, which can be postponed without do harm to the patient, you will set free additional healthcare workers from the operation theater and the anesthesia unit to help and to support the people on the intensive care units, and you will set free beds to treat the patient. So these measures has to be taken very, very quickly. And the last year in March, the Chancellor and the Minister Presidents, they did these measures, and now we don't hear anything about this.
Well, the politicians obviously think that these new measures are enough. From a medical perspective, are these measures enough to get things under control here?
Yes, overall, these measures may have an effect, but unfortunately, they come far too late. The pandemic hit Germany with full force. In southern Germany, as I said, and other regions, we have exorbitantly high numbers of infections due to low vaccination rates. And intensive care medicine is at the limit of its capacity. Therefore, in addition to these measures, we have to intensify the vaccinations as much as possible. But above all, the booster vaccination. And unfortunately, the vaccination centers were closed, even though the development was foreseeable. Now we are chasing after things.
All right, Dr. Uwe Janssen with the German Society for Internal Intensive Care and Emergency Medicine. Thanks very much for your time.
Thank you.